Hello and welcome to the topic Patent Ductus Arteriosus in the module Cardiology. By the end of this topic, you should be able to define patent ductus arteriosus, or known as PDA, describe the pathophysiology of PDA, identify the signs and symptoms of PDA, describe the investigations done to diagnose PDA, and outline the principles of management for PDA. Let's get started. The preferred term is patent arterial duct, and it is defined as a congenital cardiovascular defect in which the arterial duct or ductus arteriosus is open beyond the normal age of spontaneous closure. It is generally classed as acyanotic. However, uncorrected PDA can eventually lead to late cyanosis in lower extremities termed differential cyanosis. PDA is the connection between the pulmonary trunk and descending aorta, which is usually the ductus arteriosus closes with the first breaths due to increased pulmonary flow, which enhances prostaglandin clearance. This is more common in premature babies and babies that are born at high altitudes or those with maternal rubella infection in the first trimester. Patent ductus arteriosus produces a left-to-right shunt. In other words, it allows blood to go from the systemic circulation to the pulmonary circulation. The patent ductus shunts blood from aorta into the low-pressured pulmonary artery, then flowing into the pulmonary capillaries, subsequently into the left atrium and ventricles. Symptoms occur around 6 to 10 weeks of age, and patients may develop congestive cardiac failure. A history of effort intolerance, palpitations, and frequent chest infections are also seen. Signs include wide pulse pressure owing to the leaky flow from the aorta to the pulmonary artery, prominent carotid pulsations, hyperkinetic cardiac apex, an accentuated S1 while S2 is narrowly or paradoxically split. Continuous murmur with a peak at second sound is an important distinguishing factor, best heard at the second left intercostal space. Echocardiogram is used to identify any defects within the heart chambers and to assess the overall function of the heart. Cardiac catheterization provides information on the pressure gradient between chambers and vessels and is also used to evaluate cardiac shunts. Eisenmenger syndrome describes the reversal of a left-to-right shunt in a congenital heart defect due to pulmonary hypertension. This is appreciated in patients with severe disease. This occurs when an uncorrected left-to-right shunt leads to remodeling of the pulmonary microvasculature, eventually causing obstruction to the pulmonary blood flow and pulmonary hypertension. In this case, it can be associated with patent ductus arteriosus. Features include original murmur may disappear, cyanosis, clubbing, right ventricular failure, hemoptysis, and embolism. Here, the management would be heart-lung transplantation if required. Now, let's quickly go through the cardiac catheterization and oxygen saturation level interpretation. We start off with the basics, where deoxygenated blood returns to the right side of the heart via the superior vena cava and inferior vena cava. It has an oxygen saturation level of around 70%. The right atrium, right ventricle, and pulmonary artery normally has oxygen saturation levels of around 70%. The lungs oxygenate the blood to a level of 98 to 100%. The left atrium, left ventricle, and aorta should all therefore have oxygen saturation levels of 98 to 100%. Remember, a PDA connects the high-pressure aorta with the lower-pressure pulmonary artery, and this results in only the pulmonary artery having intermediate oxygenation levels. The treatment of patent ductus arteriosus can be divided into medical and surgical approach. Prostaglandin inhibitors like NSAIDs, indomethacin, or ibuprofen can be initiated for ductus arteriosus closure. Management of cardiac failure is key, and agents that can be used are beta blockers, diuretics, and ACE inhibitors. Surgery is done for small infants with large ducts and in cases of failure of medical therapy, severe heart failure, and if there are any contraindications to medical therapy. If associated with another congenital heart defect amenable to surgery, then prostaglandin E1 is useful to keep the duct open until after surgical repair. Let's summarize. Patent ductus arteriosus is an acyanotic congenital cardiovascular defect in which the arterial duct is open beyond the normal age of spontaneous closure. The patent ductus shunts blood from the aorta into the low-pressured pulmonary artery, then flowing into the pulmonary capillaries, subsequently into the left atrium and ventricle. Important signs to look out for are wide pulse pressure owing to the leaky flow from the aorta to the pulmonary artery, prominent carotid pulsations, and a continuous murmur with a peak at second sound is an important distinguishing factor, best heard at second left intercostal space. Treatment is targeted at managing cardiac failure symptoms and closing the duct using medical therapy. If fails, surgical correction is done. We have come to the end of this topic. Thank you.